Hi, I'm Ahava Tag, and welcome to What Did You Learn? I'm very excited to have here today two very special guests, Dr. Anthony Slonim, who is the CEO of Renown Health, and Suzanne Hendery, who is the Chief Marketing and Customer Officer at Renown Health in Reno, Nevada. Thank you so much for being here. I really appreciate it. So my audience loves to get to know people a little bit better, and one of my favorite questions has been, what has been your go-to ice cream in the last 9 months?
I'm all about chocolate chip.
Okay, awesome. And Suzanne?
Trader Joe's mint chocolate chip.
So good. Do you get the ice cream sandwiches?
Yes.
So good. Okay, great. Well, we always like to know what comfort food people are heading toward. So I want to ask you both, in your roles as leaders at this health system, what do you wish you had known before the pandemic started?
I think for me, not that I could have prepared for it any better, but I wish I knew how mean people could be to each other. I think that we've all watched and learned about the psychology of stress and what that does for people. And there's those historic experiments they did with rats about when you put them in close proximity, how they start picking on each other and fighting for one thing after another. And I think in the context of the pandemic, while we didn't allow our brains to go to that place, people's behavior certainly becomes animalistic.
That's really fascinating. Suzanne, what about you? What do you wish you had known?
Well, maybe following on to that, just how long it would be before we had a light at the end of the tunnel. I think going into it, and we started very on in late February planning for this. I would not have imagined it would have taken this long to get to a vaccine. So the stress that has put on our caregivers, long over time, month after month, day after day, and our senior management team and our community and our world, has really kind of led to the stress that Tony just talked about. It's felt like a long time, right?
Yeah, I say it's been 700 years. That's how long it feels. So I want to sort of ask you, so people can be mean to each other and it's so long and everyone's mentally stressed and just burned out. Resources are limited. I think we really saw that in the early days of the pandemic with, the PPE and just scrambling to try to get things. How did you sort of motivate and inspire your staff to keep going when it just felt like the most steep uphill battle ever?
I think that we certainly rely on the staff's intrinsic resilience to get them through, in part, and motivating that resilience out of them when times are tough. That comes with being honest, speaking from the facts and the data, addressing how hard it is, and sharing with them your vulnerability as it relates to the fact that you don't know everything. And you can't know everything in the context of the pandemic, but it just makes us more real as we try to battle this together. I'd like to be able to provide all the answers, but from a leadership perspective, I can't because I don't have them.
Right. That transparency is incredibly important. Yep. Suzanne, how about you? Because your people were on the front lines, like working communications, things were changing rapidly, like almost, I've heard from other people, sometimes they would put out something and 5 minutes later, it would, a new directive would come out. What did you say and how did you organize yourselves to decide, what was going to come first and how to prioritize?
Great question. We took our cues from Tony, which was basically stay calm, let's get the facts, let's wait till we have the facts, let's lead out where we need to lead and follow where we need to follow the governor or the state or the CDC or our local community. And then once that communication was prepared, getting a whole lot of approvals and alignment in terms of the language. We used a lot of language to reduce anxiety. So we were very specific about every single word. Tony was always the lead spokesperson organization. He made some very bold moves that in the very beginning around testing and this alternate care site that made our employees and our community feel secure and safe, like we were planning for the worst possible outcomes. And I think that really started late in February, to your point, and we've just been keeping that communication, not just through the vaccine, not just through COVID, but the murder of George Floyd. I mean, all the things that we've encountered through this time, we've kind of kept in that same stream of communications. And Tony's always been kind of the lead, and everybody has been aligned to that leadership, which has been very helpful.
Yeah, it sounds like a rigorous process that you just keep following over and over again. So, Dr. Slonim, I'd love for you to talk more about some of those bold moves that Suzanne was talking about. And then I would love for you to talk about how you got those ideas. Did you lean into your experience? Were there ideas that were being shared in the medical community? Sort of, I think people are always looking for where does that inspiration come from? So I'd love for you to address, what the ideas were and then where they came from to you.
So a couple of things, and it's not about me. One of the things that is so important here, I have a bunch of education in fields that are highly relevant to a pandemic. I have a doctorate in public health. I'm a physician. I'm an intensive care physician. And I have early experiences in my career, both in the public health service of the Commission Corps of the Public Health Service, as well as, in Washington, D.C. during 9/11. And so I have a cadre of experiences that bring you to how do you operate in the context of unknowns. I think the most important part for me is, which is why your leadership team is so important to you, no one person can have all of the lenses that you need to have to combat something as broad and scaled as a pandemic. And so you need to rely on your team, all of whom have valuable contributions from their lens. And then you integrate it all and you make a meatball out of it and you try and figure out how you go forward with those variety of perspectives. You can't take everybody's perspective. You got to sort and decide and manage and manipulate the data so you can execute in a way that's streamlined and efficient. And I think that's what we did. And it's not me, it's the team that was able to bring those variety of perspectives forward and allow us to get where we needed to be.
What do you think is a learning that's come out of this that will stick with you, for the rest of your career?
For many years, our citizens in the United States suffer from chronic conditions, excess mortality, and it's not from a lack of investment. We pour a whole bunch of money into health and healthcare, yet our outcomes are diminutive when you compare them to other industrialized nations. I don't think we realized just how fragile we were as a healthcare system. And I think this has, we stopped as a nation investing in public health decades ago. And public health is like an insurance policy. You don't need it until you need it. And when you need it, you don't have time to go buy it. You got to have it on the shelf with the premium paid up so that you can get ready to use it. And we simply had lost sight, I think, from a public health perspective about what those opportunities were. And that's made me question and interrogate whether or not we actually have our act together on some of the healthcare, more rudimentary everyday healthcare things like chronic disease and those kinds of things. Yeah. Should we be doing better? And what have we learned as a result of rapid fire decision making in the pandemic that we can apply in a new frame to how we might better care for Americans?
Right. I mean, listen, in middle school, I had three years of health classes where they taught you about all this stuff, and you had to learn, all about mental health, physical health, sexual health. I mean, all of it. I don't think they teach those classes anymore. There's seminars that they give, on a random Tuesday in March. Suzanne, how about you? From a communications and marketing perspective, what did you find out about your team and what you were capable of, and what do you hope to see come out of this, so to speak, a silver lining, as grim as it has been?
This is more personal in answer, but I think the importance of having your values align with the senior management team and your leadership structure, that has been reinforced to me throughout this pandemic, that there's many of us working in organizations where we might not see eye to eye with the values or the leadership that's being exhibited. And if people are in that place, it's time to move on, I would say, because we had a very important meeting where Tony and our chief of staff, we were going through a lot of financial difficulty, and we were thinking about having to do a reduction in force of our team members. And we were in a conference room that had our vision and our values on the wall. And at a certain point in the discussion, Tony and our chief of staff looked at the values on the wall and said, caring is our value. If we cared for our people, would we be thinking, what else can we do to reduce costs? And can we hold on to people while everyone else is being laid off in this community, so that we don't have to furlough people, we don't have to lay people off, and we can preserve those families and our economy? And all of a sudden, it was almost like they asked us to reach higher, because everybody started feeling aligned to this very important mission, that we might not be able to escape COVID, but maybe we could keep our team secure. And every senior leader stood up and said, I can cut this. I don't need to do this. I can put this off for a year or two. So we were all aligned, even though we're very diverse. Our values are all centered on the values of this organization. And Tony brings that home every day in terms of, if we're leading with our values, what would we do next?
Right. I always say that integrity is when you're aligned with your values when no one is looking.
That's exactly right. That's exactly right. And I think our leadership team has gone through a lot of kind of dynamics over the last 4 years, but we had the perfect leadership team for where we found ourselves.
Yeah.
Everybody was 200% in, not only on the senior leadership team, but my own marketing and communications team. The silver lining is that I had the time to get the right people assembled. So when this came, everybody was able to step forward, and they cross-covered for each other, and they were 200% in. They are 200% in. And Tony's also got a strong value about, when people get burned out, give them a day off. Let them recuperate. Let them recover. You can't run for 10 months, 24/7 with the adrenaline that brings, and not take a rest. And we love what we do, and we're even more at risk because we love what we do, because we don't want to give it up. But
right.
Very insistent that people need time to rest, which we appreciate.
Yeah. Put your own oxygen mask on first, right?
Exactly.
Right.
So, Dr. Slonim, I'm going to put you on the spot here a little bit, but what I've heard from a lot of other CMOs at healthcare institutions is that the CEO and the C-suite has a much greater respect now for marketing and communications. And it sounds to me like you already had a very healthy respect. Do you think your understanding of what happens at that level has expanded? And do you have any greater appreciation for it?
I have tremendous appreciation for the marketing team, but it didn't come because of the pandemic. It came because of my close relationship with Suzanne that evolved over years, where I've been a good student and learned along the way. It didn't take the pandemic to teach me. And
Okay.
so I think that I certainly have an appreciation for the great work that the team does. And we've been able to see that executed in the outcomes. Never before I met Suzanne did we ascribe the marketing outcomes to the team. If you're going to invest in something, shouldn't there be outcomes? Well, obviously that makes lots of sense. And we talk about that in IT all the other divisions, but
Yeah.
we had not, until Suzanne got here, we had not talked about that in marketing and communications. And there's a real return on investment that accrues because of that work. And I've become a student of that early on, and been blessed that I have such a great partner in Suzanne and helping me to get it.
Yeah, no, you're lucky. It sounds like you guys have a phenomenal team. All right, I know, I've taken enough of your time and I really appreciate it. Just tell me quickly, Suzanne, you first, where's the first place you're going to go when we're able to go someplace again?
Well, I'm going to go over the bridge to Canada. My dad and our youngest son are both in Canada, and I never thought that they would ever close the access to the bridge to be able to get to Canada. So we will get in our cars and drive over the bridge to Canada.
I hope it happens sooner rather than later. How about you, Dr. Slonim?
I'm going to Nashville, Tennessee. I have a granddaughter who turns 1 year old today, and I've only seen her once. And I've missed an entire year of her growth and development, a very precious year.
Yeah.
And so the first thing we're going to do when we can travel is get down there to see her again.
And thank you so much for being here. I really appreciate it. I learned so much, and I know that my audience will as well. So thank you.
Great.
Thanks so much.